First, I've got two questions. The first one is kind of quick. Medical marijuana, I've got a number of constituents and one family in particular where schizophrenia with the medical marijuana card, they're trying to get the son, or in this case, their son off of it, but the doctor is telling them that at Torrance that they don't have the ability to revoke that card. What is your data tracking these mental health effects? Are you tracking the increase in schizophrenia and as a result of the medical marijuana cards? Because it's not like I've just got one.
I'm not tracking that data specifically.
I think it's something that's important that we do, especially if we're going to consider full-blown legalization.
Thank you.
Next, I want to go back. Thought-provoking is a phrase that is sometimes used, and my earlier line of questioning was meant to provoke some discussion, and it was successful in doing that. Black maternal health is a serious issue in this Commonwealth, and it needs to be addressed. But the lack of discussion until very recently about rural health. Do we have information, are you tracking the difference, the infant and maternal mortality rates for rural Pennsylvania versus areas that, and how do they compare?
I can get that. We have on our website data by county and for many of our health metrics. So you can look at your individual counties to determine what the statistics are. And I don't have that book in front of me with all of our data, but we have dashboards with data as well as reports. So if it's okay, I'll get back to you on particular mortality reports. Part of the challenge in some of the communities, depending on the, infant mortality is, thank goodness, a rare event. When you have smaller populations, sometimes the data are censored for small numbers. But I certainly, we have, most of our reports are by county as well as by across the state. So I'll happy to look through. Is there particular statistics you would like us to share with you?
I'd like both for the women, or the maternal and the infant mortality by county, and I'd also like you to track very closely with both Elk and now Potter counties losing theirs, what kind of an increase we're going to be seeing. I'm very concerned that that is going to happen. And I want to also thank you and Senator Hughes for coming up and actually paying attention to Bucktail. It's over if we lost that hospital, it's over an hour drive just to get to an emergency facility. We've had these, unfortunately, since all these reporting requirements that are required on physicians and hospitals from the federal regulations, it's caused the senator, the senator from Montgomery County and I agree very much that these hospital systems buying these physicians up, a big part of it is also our Supreme Court opening up the venue shopping. Upon Lahawkee's signs are out here now. And our doctors, they can't afford the malpractice insurance, so instead of having private practices and us having private hospitals like Bucktail and the ones that Senator Haywood's concerned with in Philadelphia area, it's forcing these consolidations, and both with the federal reporting requirements and, like I said, the venue shopping for our physicians. Those are huge issues that are really having a heavy impact on our medical. Thank you.